In this video we are going to talk about the 10 most dangerous surgeries. So before starting this video, please like this video and subscribe to our channel for future updates. According to a new study, 10 types of operations, such as appendectomy and gall bladder removal, account for 4 out of every 5 emergency general surgery deaths in the United States. Partially removing the large or small intestine, surgery to heal a bleeding or ruptured ulcer, separating adherent abdominal organs, appendix removal, gall bladder removal, and open abdominal surgery are among the techniques. Emergency general surgery, a specialty that focuses mostly on abdominal health problems, is also responsible for 80% of complications, according to researchers. According to new data, only 10 procedures account for over 80% of all hospital admissions, deaths, complications, and expenses associated to emergency general operations across the country. More than 3 million people are hospitalized to hospitals in the United States each year for emergency general surgery, with the greatest risk and most critically unwell patients among them. Dr. Joaquim M. Havens, head of emergency surgical services at Brigham and Women's Hospital in Boston, said he noticed that patients who came in with major medical conditions requiring unanticipated emergency surgery weren't doing as well as he believed they should. The outcomes are so different when you look at procedures done urgently versus procedures done electively, he told CBS News. It pushed me to go a little further into what was going on. Between 2008 and 2011, Havens and a team of researchers studied a government database of approximately 420,000 individuals who underwent emergency general surgery. The investigation did not include heart-related operations or surgery as a result of stressful occurrences such as vehicle accidents. The researchers classified operations according to their total burden, which included frequency, complications, death rates, and financial expenses. In the end, they discovered 7 surgeries that accounted for 80% of procedures, 80% of deaths, 80% of complications, and 80% of inpatient costs across the country. Here's the list of 10 most dangerous surgeries. 10. Partial colectomy. A partial colectomy, or removal of portion of the colon, was the procedure with the largest burden in the study. Although this is not the most prevalent procedure on the list, Havens claims that it has a high mortality and complication risk when performed in an emergency. I believe it's for a variety of reasons, he explained. Colon illnesses that require emergency surgery can be very serious, such as diverticulitis or perforated malignancies, which can make patients very sick when they arrive. Doctors frequently have time to prepare the intestines before surgery when done electively, he noted, by washing the colon. However, when done urgently, there is substantially less time to do so, making the procedure riskier and increasing the chance of complications. 9. Small bowel resection. A small bowel resection is a surgical technique that involves removing a portion of the small intestine. According to Havens, this surgery is high on the list because patients who require it are often very sick, which can lead to additional difficulties. There are a variety of disorders that lead to it, he stated. Bowel blockages, tiny bowel tumors, and other conditions that make the patient very unwell when they occur. 8. Gall bladder removal. Gall bladder removal, often known as a cholecystectomy in medical terms, was also high on the list, although not because of its high complication rate. In general, this surgery is relatively safe, with a minimal complication risk, Havens stated. He did warn out, however, that there are significant distinctions in the causes when it's done voluntarily versus when it's done in an emergency. He explained, it's often done electively for moderate indications of discomfort. And when it's done in an emergency, it's for a severe infection or gallbladder obstruction that can make you very unwell. Havens further pointed out that because the operation is done so frequently, even little deaths or complications are emphasized. 7. Operation for peptic ulcer disease. Peptic ulcer disease is characterized by painful sores or ulcers in the stomach lining. These ulcers bleed occasionally and must be managed. Proton pump inhibitors, for example, have been discovered to help prevent the condition, therefore surgery is not particularly common. Havens stated, it used to be considerably more frequent 30, 40, 50 years ago. As a result, the only patients who require surgery are those who have previously failed alternative treatment, making procedures much more challenging than they used to be. As a result, while this procedure has one of the lowest rates of complication and mortality on the list, it also has one of the greatest rates of complication. 6. Removal of abdominal adhesions. Patients who have had intestinal treatments may develop painful adhesions months or years later that require surgery to remove. This one is interesting since it's a first-world sickness, Havens explained. We found that in the undeveloped world, where patients don't have many procedures, this isn't a concern, says the researcher. Abdominal adhesions can cause major problems if left untreated, making emergency procedures a risky option. Patients who are sent to the operating room within a day after presenting with a bowel blockage may have a dead or ruptured intestine, which makes them quite unwell, Havens explained. 5. Appendectomy. The study found that removing the appendix is a fairly safe treatment, even when done on an emergency basis. However, in terms of costs and frequency, it came in first. Havens stated, "This one is really safe. The death rate is really low, and the complication rate is also very low. But because we do so many of them, the cost multiplied by the frequency means that it costs society a lot of money, but not in terms of lives lost or time lost, which is how it made the list." 4. Laparotomy. When no other treatment is available, a laparotomy is performed to open the abdomen. The researchers discovered that though this treatment was not widely used, it had a high mortality and complication rate. You would expect those people to perform horribly if you open up the abdomen but don't do anything therapeutic on the inside because you either uncover awful cancer or some other condition that can't be treated, Havens explained. A laparotomy is also used to implant a feeding tube in individuals who have had a stroke and are unable to eat. Those patients, on the whole, don't do well, Havens added. So it's not the operation that's so risky, it's the fact that you're having the operation that implies something else is going on. 3. Esophagectomy. Because of cancer, this treatment is done to remove part or all of the esophagus, the tube that delivers food from your throat to your stomach. To prevent the cancer from spreading to the remainder of the stomach or other organs, an esophagectomy is performed. The lymph nodes are frequently removed as part of the surgery. The incisions are created based on the procedure's severity and the amount of esophagus that needs to be removed. The esophagus, a portion of the belly, and lymph nodes are removed by incisions in the chest, abdomen, and throat in the most severe case. The most serious concerns are bleeding, fluid leakage into the stomach, clotting, and infection due to the structure of the incisions. It's possible that the lungs will be damaged as well. 3. Spinal osteomyelitis surgery. Spinal osteomyelitis is an uncommon but serious infection of the vertebrae that causes back discomfort. Surgery is usually the last resort for treating this infection, although it is sometimes necessary, especially when sepsis develops. Spinal infections are exceedingly serious, and surgery to the area can be perilous, resulting in paralysis or further infection. 2. Gastric bypass. Gastric bypass is a surgical operation that alters the way your stomach and small intestine process food, allowing you to reduce weight. Because the organs are so close together and the physician must cut through so many layers of fat, this operation is both elective and hazardous. Although laparoscopic surgery makes this process a little easier and avoids large incisions, there is still a higher risk involved, especially because putting the tube into the airways is more challenging. Excessive bleeding and infection are two additional dangers. 1. Separation of conjoined twins. Identical twins that are connected in utero are known as conjoined twins. Conjoined twins are an extremely unusual occurrence, with just 1 in every 50,000 to 1 in every 200,000 births resulting in conjoined twins. The surgery's risk and difficulties are determined by where the twins are connected, with twins connected at the heads being the most common. Depending on how much of the brain is shared, separation is feasible. So that's it for today's video. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button and turn on the notification bell before you go. Thanks for watching.